Let's stick with that story now. Bring in DA Health spokesperson Michele Clarke. Michele, a very good evening to you. Good to have you on Newzroom Afrika. The Minister of Health, Joe Phaahla, saying they take responsibility. They are ashamed. He himself will be monitoring the implementation of the report by the Health Ombud. Your reaction tonight?
Thank you very much for having me on your show, and good evening to your listeners. Well, this incident is an atrocity that happens in our health facilities quite often. And we had sent this inquiry through to the Ombudsman for investigation, and the report was released, and there are some recommendations that have been made by the Health Ombudsman that need to be adhered to. Now, I mean, if a patient is presented to any of our healthcare facilities in terms of rape, they are bound by law to ensure that they give the best medical care. And this did not happen in the case of Miss Vina. And this young, innocent girl could have still been alive today if she had got the treatment she should have got from our healthcare professions. And it's an atrocity that nurses behave in such a manner. I mean, there was no file even opened for this young lady at all. Her condition was jotted into a personal diary of one of the nurses that was found guilty. And so there was absolutely no record even opened up in terms of her condition. She was treated in the most inhumane way, completely against her constitutional rights in terms of Section 27(1) of her Constitution. And obviously there must be repercussions in terms of this issue. Now, in terms of the recommendations, the Ombudsman has said that they need to go under disciplinary procedure, and we will be watching very carefully to see that happens. And you know, I just feel for the minister to say, you know, they must go and apologize to the family. I mean, how do you apologize to the family when you've lost your child through negligence through our public health system?
And just on that, Michele, just on that point, I mean, these two nurses have been recommended, or the Ombud says they should face a disciplinary process, as is in line with labor law basically in South Africa, right? When you look at this case, this woman was gang raped, came into a facility, instead of being given treatment, which was urgent, clearly because she died, was told, or in fact the person who brought her in was told that they needed to go to a police station first. We're talking about this case because Ms. Vina died, but the most frightening thought perhaps is this: how many times has this happened before and gone unreported?
Absolutely. There are many, many cases that I deal with on a daily basis where people phone me when they are being mistreated at hospitals, and if it wasn't for my intervention on that particular day, things could have been a lot worse for the outcome of that patient. Now, the private sector has 3 years ago approached government to say, we will assist to train your health professionals within the private healthcare system, because we just don't have enough facilities anymore to ensure that our nurses are really trained well. Over and above that, nurses work in incredible difficult environment because they are short of so many operational needs that they need in order to do their jobs. And of course, our hospitals are so unbelievably overcapacitated. So for 3 years, they've been saying to government, we will help you. We will train your nurses for you. Government just has not got their act together in order to change that legislation. And that is something that is extremely important that we should look at. The private sector brought that up in November last year at the Presidential Health Summit, saying, please, let's get this legislation changed, you know, so that nurses are trained properly, because many of our nurses are just not trained in order to cope with what they need to cope with. But in this case, it looks, you know, when I read this report, this was sheer negligence on the public health system.
With that in mind, then, is firing the two nurses involved the only way at least the employer, the health department, can be seen to be taking this seriously?
Absolutely. You know, obviously the investigation now has to also conclude, and the Nurses Council has also been asked to investigate this case. And as soon as those reports are ready, we will definitely insist to see those reports and to see what the findings are and what's going to happen to these two nurses. They've got 1 month to do this investigation, and as soon as those reports are available, we will certainly make sure that action is taken in terms of those reports. We will also be visiting the clinic once again to see that the various recommendations that have been made are definitely adhered to. But, you know, there's a recommendation in this report that the SAPS must adhere to as well in terms of rape victims and what processes should be followed. And this is another critical issue that needs to be looked at, because, you know, many young girls that go to the police station that are raped are treated with the most incredible discontent, and that should not be happening. They are not the perpetrators, they are the victims.
Michele Clarke, DA Shadow Minister for Health, or, well, DA member of the Portfolio Committee on Health. Good to have your time.